Okay, hi, my name is Rihanna Donald. This is my submission for assignment 3. My student number is T007263888, and this is my clinical mentor, Rochelle. So this is Bean. He is a 1-year-old non-neutered male who is in for a neuter today. So his current vitals are, well, he's 29.4 kilograms, his temperature was 38.9 degrees Celsius, heart rate was 120, respiratory rate is 28. He's currently bright, alert, responsive. He was a bit more happy when he came in, but now he's a little bit more, just, I would say a little more nervous, but still doing good. Wet gums, all of that. So we're going to be giving him a mixture, a cocktail of hydromorphone and dexmedetomidine, and that is going to provide some pain control and sedation for his upcoming neuter procedure. And I'll explain a little bit more about the drugs after we give them. So I will get you to give a hold here.
Can I help you?
Oh, come here. Oh, I know you're okay. So I'm going to landmark here. I'm going to find. You are a little bit chonky.
A little chonkers.
Right.
When you're just about to poke.
And
A little bit close to the spine there.
So I've got my hand on the spine right there.
Good boy.
Feel good about that spot there. Bevel is up, poking. And we are done.
Sorry.
Okay. So we are going to give him, we gave that as an IM injection. So we are going into the epaxial muscle. So we are going to give him 10 to 15 minutes to let that kind of stew, and then we'll check back on him. We can put him into the kennel, but I am going to describe the drugs and the effects that we're expecting to see. Come on, bud. Okay, so to touch base on the drugs that we just used and their effects, families and such. So we used a combination of dexmedetomidine and hydromorphone. And dexmedetomidine we'll start with. So dexmedetomidine is an alpha-2 agonist. It is going to provide us with sedation, but mostly with sedation and mild pain, analgesic effects. Things that we want to watch out for in this drug are respiratory depression, bradycardia, and hypothermia. So we've got a heating pad on the surgery table right now that is just heating up the blankets that we'll remove before we put the animal onto it. And then with that drug, we just want to continue to monitor all of the vitals and make sure that we are not seeing anything concerning, but we are going to most likely notice a decrease in the heart rate, a decrease in the respiratory rate, and potentially a decrease in temperature as well. Then for hydromorphone, so that is a strong opioid. That one is going to give us most of our pain control effects as opposed to our sedation effects, but it will work as a mild sedative as well. With that drug, we expect to see things like panting, sedation, and vomiting, so it wouldn't be a surprise if we did go in there to check on him and he has vomited. My suspicion of how he should be once we check on him is going to be moderately sedate, so he should be unsteady on his feet, kind of drunk-like presence. He should have mild responses that are delayed, like he's just overall going to be moderately sedate. So that's what we expect to see from those drugs, but we'll check back in once he is sedate and see what's happened. I do want to make a side note that I have set my timer here. So we started the video at 12 minutes. The video was about 2 minutes long. So it's been about 10 minutes now that he has been under. I'm going to go check on him and see if he's ready to go to the next phase. So this is Ian after about 20-25 minutes of giving the dexmedetomidine and hydro injection. His heart rate is 60, his breaths per minute are 20, and his temperature is 38.3. So he is mildly sedate. He still has some responses, so he can still pick up his head. He's still looking around, blinking. I would suspect that if I touched his ears, they would move. So right now we would call him in a mild sedation. Yeah.
Is that what you were expecting?
That is not what I was expecting. We were expecting to have him in a moderate sedation, so to be a little bit more, yeah, thank you for asking that. To be a little bit more like wobbly on his feet, that kind of thing, but this is okay. We'll just start here and go from there.